Dear friends, myself Dr. Zirpe and along with Dr. Rahul Pandit have decided to come up with the online module regarding the organ donation awareness. Now, the learning objective for this particular course are, we are going to test the knowledge by doing the pre-test before these online modules. Okay, what is the knowledge of the participant regarding the organ donation, its process, its optimization? Then second learning objective is we are going to give them the knowledge. We are going to train them regarding the organ donation, declaration, as well as the optimization and maintenance of the donor and various legal issues regarding that. So that is the entire purpose of this online module, to create awareness, to train the trainers, to train the participant regarding the organ donation process, its optimization and declaration. Why we have decided to come up with this online module? THOA Act came in practice in India in 1995. More than 25 years have gone. Still, we are struggling to create awareness about the organ donation. Still, we are struggling to train the medical practitioners to optimize the donor. Still, there is a lot of gaps in identification of the donor, and we are losing every day, every yearly, the majority of the donors, and our organ donation rate is not jumping. If you see, or if you would like to know, there are thousands of the acute liver failure patients, thousands of the heart failure patients, lakhs of the kidney failure patients are waiting for organ to get. And cadaver organ donation is one of the hope. It will help to reduce that gap between the need and availability. At present, suppose there are 50,000 liver are expected or needed, hardly few hundreds of the liver transplants are happening. So we need to create awareness amongst us. We need to train ourselves for getting the more and more organs by optimizing the donor properly. And that is what the entire purpose of this particular online module. What is the current status in India? I already explained the situation is not good. The need is more, availability is less. There is a variable practice across the India. Even in one hospital, one critical care unit and second critical care unit will have the different ways of managing the cadaver organ donation. There is a poor concept of the potential organ donor. We need to pick up those organ donors in a priority so that we will not land in a crash organ donor. Sometimes what happens, families are willing for the organ donation, but the patient is not in condition to donate the organ. So concept of the potential organ donor needs to be established. This is the problem in India. Poor understanding of the laws. Majority of the medical practitioners are still hesitant to declare anyone brain dead, still hesitant to discuss with the family regarding the organ donation. They are least bothered about the counseling and preparing the families because of the medico-legal issue. They feel that they might come under the medico-legal aspect. So I think there are the problems are more, solutions are less. We have decided, let's educate our colleagues, let's educate our participant regarding the entire process of the organ donation. Just clear the myths about the organ donation. Just give them the facts about the organ donation. Just give them the facts about the legal issues involved in organ donation. And that is the entire purpose of this particular online module. So what are the goals of this particular online workshop? To identify and declare the donor. That means participants at the end of this course should able to pick up those donors in early phase, identify those donors, identify those expanded criteria for the donors rather than rejecting straightway, his age is more than 65 and he is not the right donor. Then after the identification, the participant should know how to optimize the donor in a good condition. We believe in a multi-ritual organ donation. One patient can donate 8 organs minimum and he can save the 8 lives. Every time our effort should be from every organ donor, if possible, get the 8 organs minimum so that 8 lives can be saved. So optimization is the backbone of the entire process. The doctor should know that how to give a fluids, how much fluid, when to give fluid, how to manage the hemodynamic status, what is the role of the hormonal therapy, what are the antibiotic. Every part the participant and the doctor should know to get the ideal donor. There are medico-legal issues. I already explained that we would like to clear your myths regarding the legal issues. There are no major legal issues are involved. There is a THOA Act is established in 1995. In brain dead patient, you can declare the patient dead if he is clinically following the all tests, and after the apnea, you can officially declare him brain dead. So one need to follow what are the rules and regulations. No need to carry it away with the print media information that there is a lot of legal issues. There are no major legal issues in declaring the brainstem death and optimizing the donor and going ahead with the cadaver organ donation. And now we know that the need is more and availability is hardly anything. We are trying hard from the brain dead donor, but now we need to develop the concept of the disease after the cardiac donation. That is the DCD. That means even if the patient is not brain dead, if the patient is terminally ill, and if the families are willing, there are various indications for that. So one need to develop the concept of the donation after the cardiac death. That is the next step. That is the future of the organ donation. That may help to reduce that gap in between the need and availability. So friends, let's go through these modules, learn these tactics or through the information, learn how to pick those donors early, how to identify, how to select, how to optimize and go ahead with the maximum donation. That's what the entire purpose of this module. Thank you.